Good afternoon, everybody. Welcome to this session today on using statistics to identify those most in need. Before we get started, can I do a little bit of housekeeping? Can anybody who's not a speaker, so any delegates, please turn off their cameras and mute their microphones, please? This session may be recorded and distributed, so if you have any issues with that, please see in the chat where is contact details if you do not wish to be included in this. And if you want to ask questions at any time during this, can you use the raise a hand button or chat box, and then unmute yourself to ask your questions at the relevant time. So yeah, if anyone new can turn off their cameras, that would be great. My name is Dr. Robert Mastrodomenico. I am Chair of Statisticians for Society. I am a fellow of the RSS and have been actively involved for over 10 years and doing various things within it. But here really today, I'm here on behalf of Statisticians for Society, and I'm going to tell you all about that in a minute. We've got a really good session available today. I'm just going to go through the programme. So you're going to get a brief introduction from me, the chair, and I'll talk a bit about Statisticians for Society. And then we've got our speaker presentation. So I'm going to introduce the speakers now just to save time, because we've got some really good speakers and to give them the most time to do what they want to do. Our first session will be the introduction to the UK's multiple deprivation measures, and the speakers will be Bowie Penney, Elizabeth Fraser and Nia Jones. Bowie is a senior analyst in the Ministry of Housing, Communities and Local Government. He is the lead analyst on the English Indices of Multiple Deprivation and provides support for policy areas on integration, faith and equalities. Elizabeth is an analyst in the Scottish Government Communities Analysis Division, dealing with poverty and deprivation statistics. And Nia is head of the Social Justice Statistics in the Welsh Government Knowledge and Analytical Services, and she has extensive experience of the Welsh Index of Multiple Deprivation and has been involved in 3 iterations between 2011 and 2019. And they're going to be our first talk for the day, and then we'll have questions for those people afterwards. And then we're going to have some of our case study examples from Statisticians for Society, and that will be Nick Ray talking about use of income deprivation affecting children indexed in study of attendance, and Marie Creddles and Roma Chappelle finding evidence of deprivation in local areas. Nick is currently engaged on a PhD project into the statistical analysis of flood risks in Edinburgh Heriot-Watt University. After completing a master's in statistics at Nottingham University, set up a consulting company, Peak Statistics, which has worked for various clients in the rail, electrical, engineering, retail and entertainment industries. Marie worked as a government statistician until her retirement in 2018. Much of her career was spent at ONS developing estimation methods for use in the census and social surveys. And Roma is a statistician with many years' experience in the government service and latterly at the ONS. She has also worked in pharmaceutical and in higher education, and nowadays she chooses to do mainly pro bono work, some of which enables her to keep using her statistical skills. And so we've got some great presenters, and this should be a really good session. For any of you who've just joined now, if I can ask, if you're not a speaker and you're just a delegate, if you can turn off your cameras and remember to mute your microphones. After each of these sessions, we're going to have the opportunity for questions. And again, you can use the chat or the raise your hand button. Thank you. So I'm going to now speak a bit about Statisticians for Society. So Statisticians for Society connects small charitable organisations with volunteer statisticians. And the aim of the initiative is to kind of help these charities to collect, analyse and present data. And in reality, it's kind of whatever the problems are for those charities. So it's a kind of consultancy-based service where we offer consultancy skills with our members at the RSS who are kind of expert statisticians. And it was set up by the RSS to enable its members to donate their time and skills to good causes, because members of the RSS said how much they wanted to do volunteer work and help out people. And this initiative has allowed us to help lots and lots of charities. Now, who can request support? So any third sector organisation, charities, social enterprises, community interest groups can request support. The criteria is fairly simple. You have to be based in the UK and you have to have an annual income of less than 1 million. Why should you get involved? Well, hopefully it's because we can offer some services to help you, but we provide support that enables organizations to use data and evidence for decision making. And it's an opportunity for you to grow your network and connect with a statistician. And what we find from a lot of these projects is we kind of create these links between our members, our volunteers from the RSS, who are professional statisticians or have the skills in statistics, with these charities. And a lot of the time we have very fruitful long-term relationships. There's also a chance to build your knowledge in the area of statistics. And the main thing, I think, for the charity's point of view, is it's a pro bono service funded by the National Lottery. So you don't pay anything for this. It's a great opportunity to get somebody in with high levels of skill to offer you a service that you may ordinarily not be able to get. Here's a kind of selection of the charities that have received support through the initiative, and we've worked with lots of charities during this. And the main kind of thing, I think, for anyone who's from a charity is if you want to request support, is just get in touch. And it might be that you don't necessarily know what you need to get from this, but you might have an idea it's something you could use. You don't have to come to us with the full plan, and we can help you out. We help you kind of develop what you need from us. You just need an idea or a problem that you have. So if you do want to get in touch, the team at the RSS is s4s@rss.org.uk. And there's more information on our website. And obviously, we're going to have speakers at this event who are going to talk to you about some of the work they've done. So hopefully this gives people ideas from the charities of what you could do. And we really would like to hear from any interested charities who think they could benefit from this. And that's kind of Statisticians for Society. The kind of main event as such will be the next talks. And before those talks start, for anyone who's come on late, I just want to reiterate, if you're not a speaker, could you please mute your microphone and turn off your video? And we will be doing questions after each of our talks. And so if you want to ask a question, either leave it in the chat box or use the raise hand option. But without further ado, I'm going to hand over to Bowie, Elizabeth, and Nia for their talk, for their session. And I'm just going to hand over to you guys.
Sure thing. Thank you so much, Rob, and thank you so much for the invitation. Lovely to see a whole range of people here and a massive invite list. So really pleased to be here and talking to you about deprivation today. Just give you a bit of an overview of what we're going to be talking about and how we're going to work the slides between us. So my name is Bowie Penney. I'm a statistician from the Ministry of Housing, Communities and Local Government, and I lead on the English indices of deprivation. I'll talk to you, go on next slide, please. Sorry, just realizing that I'm not in control of those. So when it comes up, I'm going to be talking to you about a bit of an overview of deprivation, the indices itself and some of the resources available. Then I'm going to be handing over to Nia, who leads in Wales, and she'll talk a bit more about some of the key uses of the indices from her experience, but also the collective experience of indices producers across the UK. And then Elizabeth, who leads in Scotland, is going to be talking a bit more about reflections on some of our interactions, how the group across the 4 nations works and communicates consistently about deprivation progress and challenges, and other elements of the process which you'd like to share with you. So could I have the next slide, please? Great. Up and running. So with most things, it's probably best to start at the beginning and talk to you about what we mean when we say deprivation. Often it's a concept which is inevitably linked to poverty, but poverty and deprivation aren't necessarily the same thing, certainly not in our conceptual definition of how we apply, collect and produce deprivation statistics. So on the screen now is the definition of the conceptual framework we use consistently across England, Wales, Scotland and Northern Ireland. And it's based on Peter Townsend's long-standing work on deprivation, social inclusion and poverty. And really, it's just here to emphasize that deprivation is multifaceted. It's not specifically just about poverty, although poverty very commonly is a very key factor in being classed or statistically defined as being deprived. But there is more to it, I think, is what we're trying to say here. And this just gives a bit of a fuller flavour of what we're going to be talking about a bit more as we go on. So next slide, please. We're in. Wonderful. Thank you. So, oh, no, back one. Sorry, slide 4. Yeah, thank you. So what is an index of multiple deprivation? So what we create and what we produce as part of each different indices across the 4 nations is a relative measure of multiple deprivation expressed at a small area level, covering individual countries. As you'll see a bit further on in the presentation, small areas vary between countries, but not within countries. And that's part of the reason why we have different indices across different countries. Deprivation, as expressed in the index and the indices, is an area-based measure. So it's not specifically targeted at identifying individuals who experiencing deprivation. It's much more focused on concentrations, giving an area-focused measure, and is across deprivation through different facets and different domains, which again we'll speak about a little later on. And its primary purpose is for identifying areas of high levels of deprivation and informing resource allocation to tackle specific types of deprivation. Again, a bit more on that and some key examples Nia will talk through, but also some of the other presenters will talk a bit more about those as well later on in the session. Also useful to note here that the indices tends to be updated across each country between 3 and 5 years. Partly this reflects the amount of work that goes into creating a deprivation indices, but also is to give often enough time for perhaps data to show changes or policy initiatives that have been implemented as part of one iteration and to see if they've had an impact further on in more recent iterations. Also important to think about here is the use of data and what the data is we use. So it's all about administrative data, that is data that government collects as part of due process and understanding more about its population. So think about things like tax records, crime reporting records, health information from the NHS and so forth. There's nothing primary we do as part of the indices of deprivation construction. There's no surveys or anything you might consider as a primary data collection. It's all admin-based data, which gives it a lot of confidence and a lot of strength in terms of the results and the analysis that can be done subsequently. Next slide, please. So one of the key questions I think we're talking about here today is why do we have different indices across the UK? And it's a very common question that we as a team or a group are faced with. And there's several different good reasons as to why we do have different indices across countries, certainly as we sit here today. One of the main points at the top here is about different administrative systems across each of the 4 nations across the UK. And that's predominantly because education, health, justice, and other elements of social security are collected in slightly different ways or administered in different ways across different countries, meaning that a direct comparison between an education system in Scotland and England is very difficult to achieve, basically because they're very different. There are some similarities in different elements. So across England and Wales, there are quite good synergies about some of the benefits data collected by central government, for instance, but often there's small differences, which means that a direct comparison isn't possible, not just yet at least. Different factors are also seen as important. So bullet point 3 here we see used to inform local responses to local priorities. Local also means national. So in Wales and Northern Ireland, for instance, flooding is seen as quite a challenge and something that is linked to deprivation across areas, but factors measuring that aren't included in England and Scotland. So other examples include air pollution and asylum seekers receiving benefits. So it's local focused, and that also means it's national focused. And that means that across nations, things are done differently and things are considered differently as part of the data that goes into creating the indices. Bottom 2 bullet points here. So we are, as I said, exploring some synergies and harmonising where we can. Most recently, England and Wales were able to produce a combined income and employment domain for both areas because through various different reasons, but there are examples where we're trying to meet this specific need that we know many users have. Next slide, please. Another key element as to why things are different, as I mentioned before, is about the size of geography. And here we just have an illustration of why things are different. So green at the top, Scotland, and the smallest area used in deprivation statistics are called data zones, and the average population of those is around 800. Could be slightly more. These statistics are a bit out of date, but the point still stands. Northern Ireland uses super output areas with a slightly larger average population, and England and Wales here, you'll see use lower super output areas, which are smaller areas with a larger average population. But because of that, we have been able to produce some synergies and some harmonization there. But I think it just helps illustrate the scale of the challenge across creating a UK-wide version of the indices. Next slide, please. So here is just an example of some of the outputs we produce, some of the fact sheets across England, Wales and Scotland, and also illustration of the slightly different domains in use. You can see that, well, hopefully you can see, and hopefully when the slides come round, you'll see a bit more clearly, but the 7 domains leading in England, which is on the left, and then top right, you have Wales, and bottom right, you have Scotland. And you'll be able to see that some of the domains, while similar, or even some places exactly the same, others are slightly different or comprised of slightly different data sources. So it's just to help illustrate the differences in approach, well, differences in data sources, but the similarity in approach. Maybe that's a fairer way to put it there. Next slide, please. And here, just a few examples of some of the resources and outputs available to all users, freely available online. We'll have some links at the end for you to access, but I'll talk about some of the English resources because that's what I know best. So on your screen now is a interactive dashboard created in Power BI, and this is all about just helping users understand the granularity of the data available, what a lower layer super output area is, and how that relates to a local authority area, for instance, and the level of statistics available from the deprivation indices across those two areas. So in the top right, you have a map of England, and then in the bottom right there, you'll have all the LSOAs attached to the LA, which has been selected from the local area lookup on the left-hand side there. And it's just a range of summary statistics, which are also available in many other ways on our website. Next slide, please. Here is one of our most popular tools, and this is our postcode lookup. So lower layer super output areas are pretty well matched to postcodes across England. And what we've been able to do is create this lookup tool where you can enter your postcode and it will tell you how relatively deprived that postcode is compared to others across the country. And we're able to do that in 2019, so that's on the left-hand side, but also there's a relative comparison with the data produced in 2015. So it's really a useful tool, and going back to one of the previous slides about funding applications and uses, this is one of the key ways people access English data for sure. And at the very top there, you can see how you can break this down for the individual domains as well as the combined IMD measure. Next slide, please. And thank you. And then finally, here is just an example of some best practice maps we were able to produce as part of the release. We had some prominent academics who were interested in helping, produce best standard maps because they'd seen some terrible ones online which people had produced themselves, which meant that the messages were getting a bit mixed and a bit unclear, and the misuse of data was quite wide. So we're able to produce local authority level maps here, but we also have other aggregations available on the website. So that's all from me. Apologies for the challenges at the beginning, but I'm going to hand over to Nia now. If we can move to the next slide, please, and she'll talk over some of the uses.
Hello, I'm Nia Jones, Social Justice Statistician at Welsh Government. Before I give you a flavour of how the indices are commonly used, here's a bit of signposting to the Welsh resources for those of you interested in Welsh data. There are 3 Welsh Government websites where you can access the WIM data, and these are roughly split into reports and guidance on the main website, which is the top right bit of the slide. Moving down, we have data, including open data and a postcode lookup where you can put in a batch of postcodes and output the rank or decile or quintile. all on our Stats Wales tabulation tool. And then on the left, a dedicated interactive mapping website, similar to what Bowie described for England. You can type in a postcode here and get some outputs with short deprivation profiles as well as maps for small areas. So I'll move on now. Next slide, please. So a few slides exploring how the indices are used. They can inform both local and national level work, with some key examples listed on the slide. To support local projects, the indices are used across sectors wherever there's a need to identify or evidence areas with the most disadvantaged communities. And the first example there, building an area profile, is the most straightforward use, as each producer publishes tools where you can search postcode or area name and find maps and stats that can be reused. I'll talk a bit more about targeting policies with an example in a while. But in terms of informing national insights, the indices are used to model likely demands on services such as the police force, and to monitor the success of widening access schemes in higher education, for example. One of the most common uses, though, is to combine the ranks with other data sets and explore the effect of area deprivation on outcomes. And if you move on to the next slide, I'll show you an example of what I mean. This example explores inequality of outcome during the pandemic, and the chart is from the ONS, and it shows analysis of deaths involving COVID-19 and all deaths by deprivation for England. The first blue columns for each of the 5 months shown on the chart shows the rate of all deaths in the most then least deprived areas. And the second two columns show the same just for deaths involving COVID. And we'll see in general, mortality rates are normally higher in more deprived areas, but the analysis found that COVID appears to be taking them higher still. Over the 5 months pooled, on average, the rate of all-cause mortality was 1.9 times higher in the most deprived areas than in the least deprived areas. And if we just look at deaths involving COVID, they were 2.2 times higher. Let's move on to the next example, which is quite specific, where data has been used to target a flagship Welsh Government policy at a local level. There are similar examples for England and Scotland on other schemes, other policies. So Flying Start is an early years programme aimed at improving outcomes for families in some of the most deprived areas of Wales. And the WIMD income deprivation indicator forms the basis for directing the policy. But there's some flexibility for local authorities to reach children outside the most deprived areas. The table at the bottom is just an illustration to show a few areas in Anglesey with the highest rates of income deprivation. The top area, Queensway 2, has around 70 children, or 81% in income deprived households. I'm getting a little bit of noise from somewhere. I don't know if everybody's muted. Could you just check that, please? Thank you. Because it's an area-based programme, it targets all children in the area, and the last two columns show the total number of children in Queensway 2 is around 88. So 80 of those were income-deprived households, 8 of them not, but they're all targeted by the area-based scheme. And overall for Wales, we estimate that around 40 to 50% of under 4s in income deprivation live in Flying Start areas. So if we can move to the next slide, there are a list of other examples, recent examples here of uses of WIMD. Again, there will be similar ones, other ones for the different nations. I won't read them all out, but it gives you a flavour of how the indices and the underlying indicator data can be used. To draw your attention to the first and last points here, during the pandemic, the indices have been used by public health bodies and the Ministry of Defence to identify communities potentially more vulnerable to the impact of COVID and the restrictions in place. So if we can move on to my final slide before I hand over to Elizabeth. The final slide from me summarises some national insights around which groups are overrepresented in deprived areas. I've quoted some Welsh figures here, but there's similar analysis existing for England with a link towards the bottom as part of the race disparity audit work. The Welsh analysis is framed by protected characteristics as defined by the 2010 Equality Act, and by using 3 years of annual population survey data, we're able to look at 7 out of 9 characteristics and assign responses to an area deprivation group. So these findings focus on the most deprived 10% of areas, and the bullet points look at the composition of this 10% most deprived category to highlight some groups that are overrepresented in that category. And this includes single people, disabled people, and those from Black, Asian, or minority ethnic groups. 2 limitations of this analysis to point out. One is we can't be sure of the circumstances of individuals living in deprived areas, but we know their area has a high concentration of deprived people in it. So the analysis so far hasn't covered intersectionality due to sample size limitations. So for example, we don't know to what extent age profiles of people from different groups may explain some of the trends. I'll hand you back over now to Elizabeth to round off our background talk.
Okay, this was supposed to be the end of the last conversation, but that's fine, I'll do it because it was my slide. So this is just a very quick kind of follow on from the previous slides looking at the uses of the indices themselves, but the indices have been used to look at other things, not just deprivation, not just the negative experience of people living in different types of disadvantage. They've also been used to develop a couple of kind of community asset type indices. So I'm not going to dwell on them, but just to point out, it's not all about deprivation. It can be used to look at, communities that have, look like on the face of it, they're quite deprived, but they've got quite a lot of community resilience. There's a good community spirit, that kind of thing. So, it's not all about the negatives. It's also, there's also looking at what, the kind of resilience factors, and that's become much more prevalent in the past few years. And I think that's a really good thing. So next slide, please. Right, this is just a little bit of a recap on the kinds of things that we've been sort of hearing and thinking about over the past few years. So the main thing about the indices, which has been highlighted, it's a relative measure. It identifies concentration of people living in disadvantaged conditions. It doesn't identify individuals. And that's where geography comes into it. So particularly Scotland's an issue, I think parts of Wales, rural areas, the pockets of deprivation are much smaller. So you have more heterogeneity of experience across a particular geographical unit. That can cause problems for particularly for voluntary sector who are focusing on particular areas and looking for funding. And that's going to be what we're going to be looking at in the next slide. Sorry, my eyesight's terrible. So again, okay, we'll skip over the rest of it. That's fine. More time for questions. Okay, so there's 2 things. Yeah, the bottom point is the main thing. IMDs themselves are not enough on their own, and we need to think about other sources of information. So next slide, last slide. Thank you. So 2 main issues that have come up, for as long as these things have existed. So yes, so as I said, when you have neighborhoods or areas where there's pockets of deprivation, they're quite small, and it can be very, very localized. So Glasgow's, the geography of deprivation changes depending on where you are. So Glasgow has got a lot of very deprived areas with some very small pockets of extremely affluent areas. Edinburgh's a bit the opposite. It's on the whole fairly affluent, but some pockets of extremely deprived areas. So there's geography matters, place matters. The other thing is what I call, the kind of hurdles that voluntary sector need to go through when they have to apply for funding. Because quite a few funders have exclusion criteria. So they tell you, well, you have to should demonstrate that you are addressing, issues in areas of high deprivation, and for instance, that the area that you're working in is amongst the 20 most deprived 20% most deprived in your country. Now, as I said, for some areas, this is a big problem. Rural areas in Scotland, there's very few that fall into that category. So you're in fact, that kind of approach is in effect creating an exclusion zone, which I do believe is probably not what it was intended to do. And we've had quite a lot of questions over the years about what do you do about this? And the main thing is, the funder obviously doesn't want to exclude people, but it's up to the organization making the funding bid to justify why it is that their particular beneficiaries and their particular services would actually demonstrate, make the case. So there's two. I've split it very roughly into two ways. There's lots of other considerations. One thing is you think about a smaller area of analysis. So there's been quite a lot of analysis looking at output areas, smaller areas, and that will pick up the smaller pockets at a statistical level. So that's one way of doing it. But obviously, there's quite a lot of other considerations that don't get picked up through the statistics. And that's really, I mean, I won't go through the list. Those are just some examples. But the main thing to think about is to demonstrate that the organization understands the value of its service, understands the beneficiaries, understands the potential beneficiaries, because that's the point. If someone's already benefiting from a service, that's probably in the system and that's been captured. But it's also about understanding the potential need that hasn't been addressed yet. And there's lots of ways of doing that. And I've just listed a couple of things that, areas and levels at which you can think about things. So demonstrating that one is working with existing services in the area to capture, to address need that hasn't been met through those other services, demonstrating you're collaborating, demonstrating, your communities. And communities, I suppose you need to think about that in a fairly broad way, because sometimes it's geographically located, sometimes it's communities of interest, and sometimes there isn't actually a community as such. And that's part of the problem. So people are quite isolated, they don't work together. You don't know what the problem is because people are scattered all over the place and you don't really get to see them or talk to them. And so that's thinking about who the community is, who the beneficiaries are, how do you reach them, how do you work with them, and how do you try to move the program, the thing forward. So I think I'll stop there because in most cases the questions are more interesting than the presentations. So thank you very much.
Thank you, Elizabeth. Thank you, Bowie. Thank you, Nia. And Elizabeth, you finished bang on time, so that's perfect time to finish. So if the speakers want to turn their cameras on, we are now able to take questions from anybody who wants to ask a question. You can either put it in the chat and I will ask it to them, or you can raise your hand and ask it yourself. So I'll give people a bit of time to put into the chat any questions that they have. I really enjoyed the talks. I deliberately didn't want to know too much about what you're doing. So this is really, really interesting kind of things that you kind of talked about. But I suppose while we're waiting for people to come with questions, what's the evolution of this? Where does this go from where it is now, which is really impressive? What's the kind of next steps, do you think, or where do you see this all going, or where would you want it to go more? Like, and you kind of talked about this a bit in your presentation, Bowie, when you're saying how we're not able to kind of, everything's not joined up together. Where do you see it going in terms of the future of this? Nice, simple question to start with.
That's not really fair. I think we should have been given due warning over that one.
Yeah, wow. So yeah, I can have a stab and it might get people thinking as well. But I think, so there's two key challenges I think we have and we're aware of, and we, I suppose, actively try to progress and overcome. I think the first one quite clearly is, the desire and need for like a consistent UK-wide measure of deprivation. And it's something that's gained a huge amount of traction, certainly in our more recent iterations across each nation. And I think that there's a lot of barriers to overcome with this, not least geography and method. But I think it's something that actively, as kind of custodians of indices across nations, we're keen, we're actively keen to support and work together with. And However, I think a lot of the challenges, certainly in terms of a consistent statistical geography across the country, is something that goes far beyond our ability ourselves to create and agree on. So I think there's scope to be part of a discussion, be part of the agenda, but also an appreciation that the job is much bigger than us ourselves. And I think that's the direction of travel. And I think we're all on the same bus, traveling in the same way, but we need other people to get on it as well with us. And then I think another challenge we have, I suppose more immediately, is around specific data access and data challenges. And I'm speaking specifically about universal credit and COVID itself as well. So going forward for future iterations, how do we deal with some of the challenges for instance, of universal credit being rolled out, continue delayed, but also inconsistently? How do we account for that in a timely way? But also what impact COVID might have had on some of our key ways of measuring deprivation. And I think that's something else that will need to be considered as we go forward. Yeah, Nia, do you want to hop in or correct me, I suppose, as well?
No, I agree with both of those points. I think the challenges with comparing across nations and in some of the data that are fundamental to the indices are going to be key in the next few years. But in terms of the question around evolution, and maybe on a more positive note, we are looking to use linked administrative data to try and get around some of the limitations that we talked about with the indices, which is that they look at area deprivation, and we're not sure that the deprivations are always overlapping across the multiple aspects that we look at. So we'd like to be able to look at multiple deprivation for individuals or households, and that should become increasingly popular as data sets are linked together with new provisions. So there are a few projects.
Initially, pregnant women weren't included in the vaccine rollout.
Hey guys, if you can mute your mics,
That's not me.
Brilliant.
There are some projects on the go to improve, obviously, the linking of data, and we're kind of keeping an eye on. And I'm linked into one with the Administrative Data Research Unit Wales, specifically about that. So it may be some years off, but I'd see that as being a route of evolution for the indices.
Yeah, no, it was more of a kind of, I'm pretty excited to see where this goes based on what you've said. And we've had some questions come in during that. Sari Sellers has asked, given obviously things aren't UK-wide applicable now, how would you suggest adjusting this when working with UK-wide data? So how would you adjust using the different places when you want to work with a UK-wide data set?
Can I just butt in there? Something, I mean, there's been a lot of work by other people taking our data, the data that we've generated, which is all public domain, and tweaking it again to be, be able to compare across the UK. So there's a really excellent resource on the GitHub by, I think it's Alan Parsons, and I think that's come up in the chat. There are ways, statistical ways to squish the different bits of information together to get at something that looks like it is a UK-wide index. What Alan Parsons has done is actually tweak that methodology, but also done a really, really good explanation about the pros and cons of doing this, and why for some kinds of comparisons it's not helpful, but for others it might be. And I would really recommend anyone who's thinking about this to go have a look at that resource. I'll circulate the link, and thanks to our colleagues from ONS who pointed it out to us, because I was blissfully unaware of it. So there's ways of doing it at a statistical level. I think the point is sometimes, you want something that's more locally friendly. And so that will be another product. We can't do both things with the same product. That's just the main point, really.
No, that's great. And anyone interested, Elizabeth, I think will put in the chat, or someone will put it in the chat, which would be great. A question from James Wallace: how is the DB accessed? So I suppose, how do you access the data? It might be somebody who has no idea about any of this.
Sure thing. So just looking in the chat, I think someone's put a link very helpfully to the English indices, and all the resources we produced, all the data is accessible via that link. I think also the links in the slides and presentation, which will be circulated, I'm sure, have links to England, Scotland, and Wales. All the data is available, and it can be accessed in various different ways, but it's all available through those links. Do you want to go, Elizabeth? Sorry.
You're muted, Elizabeth.
And Northern Ireland. Our Northern Ireland colleague isn't here, but it's across the 4 nations.
Elizabeth, the next question is to you, actually. Could Elizabeth explain more about her bullet point, go small output area?
Oh, that's, cryptic. So the geographical unit that we use is, as Bowie said, different across the different nations, but it's all based on building up output areas, which is the basic unit of the census. So in Scotland, we did a case study looking at Orkney, which is, very, very large data zones, and looking at the data that's available at output area level, so it's using census data to create a much more fine-grained profile of Orkney. So that's just, using data that's available at output level, which may be census data, and there's other data as well. So, but that's, again, it's just you're choosing the unit of geography that's a bit smaller, which is why I kind of skipped over it. It's not, I think in itself it's helpful, but it often doesn't give you the answers that you need for a particular situation.
Well, and not that obviously some of the questions are more generic, but there is another one to you, which is the next one in there. Do you have some sites information exploring assets in the health system?
Pass. I'm sure it's out there. There's lots of stuff out there, but I don't personally know very much. It might start. The examples I gave were very much about like libraries, meeting spaces, recreation, the kinds of community assets that people will improve people's lives, enrichment kind of assets. I'm sure there's stuff in the health sector, but I'm not aware of it myself.
Excellent. No, that's completely good. We've probably got time for one more question and we'll move on. Any other questions in there, I will collate during the next talks and we'll try and cover them at the end. So, and if you do have questions, just keep putting them in the chat, please. Has there been any work done on how areas move around IMD rankings when they are in the middle of long-term regeneration projects? For example, when that involves large-scale new housing developments, and if so, has there been any guidance on how to make sure that doesn't impact on the targeting of resources to those areas? Nice, simple question.
I'll take it. Does anyone else want it? That's a long-standing issue, and it's really, I think that's where the indices have been slightly a victim of their own success, as people see, oh, that's really important, so we'll have to use that. And this is why the point about saying it's a relative measure is really, really vital. You can't really use them to track that kind of change. You can say, okay, this area used to be in the bottom 10%, now it's no longer. And I have seen some regional targeted, performance measures which saying we will no longer be at the bottom 10%, but that's not really appropriate. So it's being very aware of how resources are being targeted and using some kind of more objective benchmarks. Now, when funding's allocated through government, pretty much all of the time I'm aware of, the kind of deprivation level as measured by the relative indices is a part of the allocation formula. The other bits are much more geared towards things that we would like to see change, will indicate a positive outcome. So we need to be very balanced about this and be very aware about how we're using it. It's a useful first indicator, but because it's relative, one area might not have changed at all, but the areas all around them have changed. So how do we disentangle those different kinds of shifting changes in a meaningful way? I think that's really what it's about.
It makes complete sense. And that will be our last question we'll do for now. I'm starting making notes on the other questions that are there. So hopefully we'll get around to everyone's questions before the end of the session. I'd just like to thank Bowie, Nia and Elizabeth for a great talk. Please stick around because we'll hopefully get some more questions for you later. And I'm going to hand over to Nick, who's going to talk about the use of income deprivation affecting children index in study of attendance. So Nick, if you can share your slides and I'll hand over to you.
Right, thanks to the last speakers. I feel like going from the kind of global to the particular here. It's interesting hearing people talk about the sort of data sets across countries or even across the whole UK, whereas my project was very much on a sort of micro level. I was basically asked as a volunteer for Statisticians for Society, right tongue twister, to look at some data of attendance at youth centres across Durham or the Durham area. Now, I think it's important to emphasise at this point that the original remit wasn't just about deprivation data. It was to do with lots of different vectors of data, columns of data in the information. And I found out some quite interesting things, which I'll just mention very briefly en passant. For example, there were things that I hadn't anticipated, like, for example, that there's quite a big difference in attendance between females and males, particularly at youth centres. It turns out hardly any males over the age of 14 attend them. Also, another very interesting thing was that young people with siblings were far likelier to attend youth centres and so on. But that has very little, those are interesting results which I passed on, but they're not to do with deprivation directly. So anyway, Durham Area Youth Services wanted data and analysis on attendance. They wanted to see whether they were basically reaching to their client base properly, and also they are thinking of trying to build or buy a hub building, and they wanted to see where the optimal placing of this this place might be. One of the vectors of data they supplied was the Idarchi data. I always pronounce it Idarchi. I don't know why, it sounds like a sort of Italian word, but I think it's meant to be pronounced Idarchi. Anyway, income deprivation affecting children index, which is supplementary to the indices of multiple deprivation. Measures the proportion from 0 to 1 of children under the age of 16 who live in low income households in a given postcode. So each postcode, which I was supplied with, had an Idarchi index, a measure of deprivation. Low-income household is defined as one where those dwelling there live on less than 60% of the median UK income. So I had these figures to work with. This is an example of the kind of data set I had. There were about 300 individuals. And I'll briefly go across because it shows how I had to approach the analysis. The left-hand column is the centre that they attended, which there were 6 or 7 altogether. Two of them were on the same site. So these letters PS, etc., just refer to the centre. The initials are obviously the young person concerned. These are up to 18-year-olds, by the way, from about 7 to 18. Postcode, the postcodes, we didn't always have all information. So, for example, the Z shows that we didn't have that particular piece of information. So this person, TT, don't know their postcode, hence don't know deprivation level. On the other hand, do know their age and that they're male. So for each postcode, we have a deprivation index. Also generally had age, male or female, whether they had siblings, distance from their home postcode to the nearest youth centre, and then number of times they attended across the board each month in the year, 2019 to 2020. Okay, so that was the set. It needed a bit of cleaning up and anonymising. Now, if I go on to the next slide, distribution of Idarchi scores. Now, one problem is I don't know, nobody, I haven't had the information, how many actual young people live in all the postcodes in question. So I don't know the actual spread of Idarki scores across the whole of the potential population, namely all 7 to 18-year-olds in these postcodes. What I do have is the information for the attenders who were actually registered as coming to a youth centre at least once. And if you look at these figures, you can see the lowest deprivation, 0.030, up to the highest deprivation, 0.368. At one of the very lowest ones, there's 49 people turned up at least once, 0.063, compared to, say, 43 at the upper end. And in the middle, roughly, 0.191, there's 57 young people turning up at least once. As I say, because we don't know the background population distribution, you can't read too much into this, but what it does show is it suggests that the attendance was spread across the Idarki range. In other words, the young people were coming from all the different levels of deprivation to these centres. Okay, so if I move on to the next slide. Right, now, this is a map of the area, the geographical area, and the black dots are the youth centres. The coloured dots are postcode locations from which at least one young person attended a youth centre. Now, the red dots are the least deprived postcodes and the green dots are the most. The rationale for the colouring system was in the computer program I used. Basically, you could have a spectrum going from red to violet, and you could link that directly to the Idarki level. And so, like, the green dots are roughly a third of the way across the spectrum. If we had more deprived areas, I mean, deprived areas that were more deprived, you might well have blue or purple dots, but we don't have them here. And you can see that the dots which represent the dwelling places of the attenders are clustered around the youth centres, which is not totally surprising because each youth centre is actually in a village or small town. But there are also a few people travelling further afield. I don't know how clearly people can see, but on the right-hand side of the map, about halfway up, there's a couple of red dots. So it's possible to see that people are travelling in. So this map may well be of some use when determining where the future hub might go, but it just really illustrates the kind of pattern of attendance. Anyway, next slide. Now, this is where the analysis vis-a-vis Idarki scores started to kick in. What I've got here is a plot across the bottom, across the horizontal axis is the oh, sorry, I've gone to the wrong slide. I've jumped one forward. Sorry. Across the bottom are the Idarki scores. Up the side is the mean monthly attendance of each young person who attended at least once. So each of these dots that you can see, these hollow dots, represents one young person, the mean number of times in a month that they turned up at a youth centre. Now you can see that the Idarki scores, because they are not evenly spread, because obviously there's only certain levels. But as you go across, what I've done is the black dots are the mean for that particular Idarki score, the mean attendance per month of young people. The red line, the dotted red line, is then a regression least squares line from these black mean dots back to the data points. In a nutshell, this red line that you see is the line at least minimal distance from all the dots in the plot. It basically shows the way the data is trending. And what's very clear here is that there is no trend, as it were, that it's horizontal. What this means is that the monthly attendance of young people is independent of Idarki score. In other words, the Idarki score, the level of deprivation, seems to have no bearing whatsoever on the number of times a young person turns up at a youth centre. Now, some of the data sets going across for the Idarki values are very small. There's only 1 or 2 people in them. So what I did was I took the 5 largest sets, which are these ones, and took those means, which are red dots, large red dots. And you can see they are more or less all on the same level. Again, suggesting that there isn't any real up-down trend relationship between deprivation level and monthly attendance. So that was one conclusion. Then I looked at each of the youth centres, and you'll see that these youth centres, their initials are across the bottom here, and the circles are proportional to the number of visits that were made by young people from the particular Idarki levels, which are now up the side vertically, to that particular youth centre. So, for example, if I look at I can't read, the letters are very small, but I think that's SOX. If you look at SOX in the middle, it's quite a large circle showing it was fairly well attended by people at that deprivation level, and so on. You can see again, for the deprivation levels, there's a fairly good spread across the deprivation level. There's a few gaps, but that might be to do with the geographical situation of the particular centre. But by and large, there's a fairly even spread of attendance. There's certainly no obvious sort of low or high deprivation at any given youth centre. Moving on again. Distance travel, yes. Now, when doing this analysis, I kind of assumed certain things. I sort of set up little hypotheses in my own mind, and one of them was, well, presumably people from less deprived areas have more access to youth centres because they can either get lifts in cars, or they may have a bike, likely to have a bike, or they may have more money to travel on public transport, etc. So what I looked at was the distance from the home postcode to each centre, which is the vertical axis here, and then plotted that again against Idarki values across the bottom. And again, I took the least squares line, that is the line that is at minimal distance from all the points. And again, it's virtually horizontal, suggesting that the distance that young people can or will travel to a youth centre is not determined in any way, or doesn't have it, I shouldn't say determined, doesn't have a correlation with the Idarki score, which I must admit surprised me slightly, as I didn't think that would be the case, but it shows that you must be careful with your preconceptions. Going across, then the last relationship that I did here, although as I say, I did plenty of other relationships, but they didn't involve Idarki data at the time, was each young person during the course of the year where the data was collected will have travelled to at least one youth centre. A few people went to at least 2. No, in fact, there weren't any more than 2. So a few young people went to 2 youth centres. What I did was calculated the total distance travelled by any given young person, i.e. throughout the course of the year, they go to a youth centre, they come back, they go to a youth centre, they come back. How far do they travel? Again, to see whether that had any relationship, the ease of travel or the frequency of travel. And again, I've plotted total distance travelled by each young person throughout the course of the year against Idarki score. And again, the least squares regression line is more or less horizontal. The best fit line is shown in red, and it's almost horizontal, meaning that total travel distance seems to be virtually independent of Idarki score. So there's no evidence from these data, at any rate, to suggest that there is a relationship between deprivation and distance travel. So in a sense, it's kind of no news is good news, in the sense that I didn't find any particularly huge kind of relationship between deprivation and youth centre attendance, which you could conclude that the youth centres are doing a good job because they're attracting people across the board. They're certainly not only attracting young people from less deprived areas, which would be a worry. So to conclude this, the Idarki data combined with other data vectors can give us useful information about the behaviour of young persons in their relationship with youth centres and the youth service. There seems to be no relationship between levels of attendance at youth centres and home levels of deprivation. All the youth centres in the data set seem by and large to attract young people from across the Idarki range, and there's no evidence of any relationship between deprivation indices of the home postcode and distances travelled or number or frequency of travel. And it would seem Durham Youth Services are attracting young people across their area from all social groups. Doesn't seem to be any effect from Idarki levels. Just to finish, I might be preempting a question here. This data was for 1 year. I have arranged, with the blessing of the RSS and also with Sarah Robinson, who runs the data, the Durham Youth Services, that obviously with 1 year's worth of data, I couldn't do any through time analysis. So what's going to happen in the future is each year I'm going to get another set of data corresponding, and hopefully we'll be able to build up some time series or other time-wise analyses. Obviously, COVID has made the latest set of data perhaps a bit exceptional, but with a bit of luck, this should be an ongoing project to try and refine the analysis. So thanks very much. Rob, can I pass the hat back to you?
Of course, yeah. If you stop presenting, that would be great. Thanks,
Yep.
Nick. That was a great talk. We're going to take questions for Nick, and I've already made a note of some of those in the chat at the end of the next talk. Nick, if you could just read through the chat, I think there are some questions around.
Yeah, sorry, I was actually.
So if you're able
right,
to just
I'm trying to think which ones.
That would be great.
You mentioned not having the numbers of young people in different areas. Doesn't that make the conclusion quite fragile? Yeah, absolutely. Yes, this is as James Beecher. Absolutely, that is a major problem. Without knowing that data, I don't know how easy that would be to collect, but clearly that would be something to look at in the future. And you could kind of go back into this set of data and see whether it's possible to put that as a background factor in. Yes.
Excellent, Nick. I think if you just have a look through the chat, there's a couple of questions around links to where your data was. If you could post them in the chat, and we'll cover all the other questions that were there for you just after the next speakers. Right. So
okay, the data was actually sent to me by the organisation, but we'll sort that out. Yes, right.
Excellent, that's great. I'll hand over to Marie and Roma, and they're going to talk about finding evidence of deprivation in local areas. Just a reminder, if you come on here and you haven't muted your mic or have your video on, if you could just turn it off and just have the speakers ones on, that would be brilliant. And Roma, Marie and Jan, who's going to be joining us, I hand over to you guys.
Okay, lovely. I can see the slides. So thank you very much, Rob. I'm Marie Cruddas, and I'm going to talk about the Statisticians for Society project, where Roma and I were the RSS volunteers working with Jan Thomas from Portsmouth Citizens Advice on a project to gather information, the aim of which was to help Citizens Advice to provide the best service they can for the people of Portsmouth. I'm going to be doing the presentation, and I'm going to describe the project and how we use the IMD data within it. And then I'm going to hand over at the end to Jan, who's going to say a few words. Roma's here, so she'll be available to answer any questions at the end. Can I have the next slide, please? So the aim of the project is to provide information to help CAP, Citizens Advice Portsmouth, to better understand how their clients prefer to receive advice. For example, it could be face-to-face or via telephone or web or video chat, email, or even via social media, and also to support their future bids for funding. So it was two aspects to it. So I'll just give a little bit of information about Citizens Advice. They're a well-established and well-known organisation with a network of over 300 independent charities in towns and cities throughout the UK. It offers free, confidential information and advice to help people on a wide range of issues. This covers things like debt management and benefits, housing, employment, immigration and asylum, as well as consumer complaints. They help millions of people every year. Their own research shows that 4 in 10 of the British population contact them at some point during their lives. Each of the local offices is an autonomous charity and it's responsible for raising their own funding. Funding comes from a range of sources such as local authorities, lottery funding, charitable trusts, as well as private companies and individuals. The Citizen Advice model, they operate through a mix of paid staff, volunteers and trustees. So next slide, please. So to address the aims of the project, we carried out several data collection activities, gathering information from a mix of new and existing data sources. The first of these was to obtain a detailed picture of local demographics, to understand the local population, and by comparing with the profile of the CAP clients, be able to identify any groups that they might not be reaching. We're just going to cover this aspect in the presentation, but it also included using the existing CAP data to create a profile of their recent clients and to see how things had changed during the pandemic. So, for example, was there a change in the nature of advice being sought? In addition, the telephone system was interrogated to analyse calling patterns. As well as these analysis or compilation from existing sources, we also collected some new data and we worked with CAP to carry out an online survey that asked people about how they preferred to receive advice. So the next slide, please. So what do we know about the area that CAP serves? Portsmouth is a city on the south coast in Hampshire. And the first thing we did was to assemble data on the population using existing freely available sources. This gave us a picture of the local population by age and sex, together with key socio-economic characteristics. And so at the top of this, we've got the sources of data that we used in developing this picture of the demography of Portsmouth. We used data here from the Office for National Statistics about age sex distributions from the mid-year population estimates, on labour market statistics from the annual population survey, and about ethnicity, accommodation and tenure from the 2011 census. So pulling all that data together and looking at it as a whole for Portsmouth, the data suggest that Portsmouth has a relatively young population compared to England. Is likely due to students at the university and also the presence of Royal Navy bases. It's broadly similar to Southampton, both university towns in Hampshire. But also we observed that Portsmouth is not as well off economically as other areas in England or in comparison with other parts of Hampshire. Over 75% of the population lived in terraced houses or flats at the time of the last census. Wage rates are below GB averages for both men and women. They're close in value to those in Southampton, but considerably lower than those in Winchester. There is a relatively high proportion of residents in occupation groups 8 to 9. These are labelled as process, plant and machine operatives or elementary occupations. And there's a low level in manager, director, professional and technical occupations. Taking these things together suggests that the people at higher grade or better paid jobs tend to live outside of the local authority area. So having got this sort of broad overview from data that's primarily at the local authority level, we followed this up to get an insight at a more granular level. And so we extended the work to include an analysis of the index of multiple deprivation. So the next slide, please. So I think some of these benefits of the IND data have been touched on before. So for us, the attraction of the IND is that data is available at neighbourhood level, it's called LSOA level. It's got low granularity that's required to understand the local area and in order to be able to focus help. It covers a wide range of topics. These were described previously: income through education, employment, health, crime, housing and environment. So as well as the overall index, you get a number of domains. And data and mapping resources are freely available. The other attraction is it's up to date, at least relatively, and definitely more so than 2011 census. And as they are national statistics, they are they are authoritative. So looking to see where we could get information or summary reports about the IMD in Portsmouth, we could see a high-level summary for Hampshire, but there was no publicly available report for Portsmouth. And so part of the project was to create a bespoke report for Portsmouth that tried to describe the information in an accessible form for the citizen advice in Portsmouth. And we created this report basically that summarises the sort of general guidance that's available, but also compares Portsmouth to local authorities in England and in Hampshire, and looks about how small areas within Portsmouth compare to each other as well as nationally. We also created data abstracts for Portsmouth, including linking the LSOA level statistical geography to more familiar administrative geography of wards. Previously, it did talk about how postcodes are available. It's a very, very small area level. In fact, for local authority type level information, wards are more familiar to people than certainly more than LSOAs. So I'm going to give a few examples of what we looked at and what was, the content of the report in the next few slides. So next slide, please. This comes from the local authority level summaries. So while the data is published for and developed for the LSOA level, summaries are available at local authority level. So here we're just looking at the English IMD, and this shows how the 13 local authorities within Hampshire, the county in which Portsmouth sits, how they rank according to the average of the rank. The rank of the average of the LSOAs within the local authority. So just a sort of summary statistics. So you can see at the bottom, Portsmouth ranks 59 out of the 317 local authorities, very similar to Southampton, which is next. So Hampshire is relatively affluent, and at the top you can see Hart, another local authority within Hampshire, and that's ranked as the least deprived in England. So that's 317th out of 317. And in fact, the top 5 LSOAs in Hampshire are in the 10% least deprived within England. So that just puts the context of where Portsmouth is within its neighbouring local authorities. So overall, from looking at the various summaries at the local authority level, Portsmouth's ranked within the most deprived 20% of local authorities in England. Deprivation isn't evenly distributed across the area, and there are some pockets of extreme deprivation that may sit alongside quite well-off areas, and this was referred to in one of the previous talks. If we looked at the various domains, and we can see that Portsmouth is most deprived within the crime and the living environment domain. It's 19th within the crime domain and 4th among local authorities in England on the living environment domain. And it sort of makes sense for Portsmouth. It's essentially an island, a very densely populated island, and so things like pollution and that sort of thing will contribute to its poor performance in the living environment domain. So next, please. So Bowie, I think, put up a picture of where you can get to all of the various local authority level maps. So we found these very useful, as these are produced by the University of Sheffield and are available from the IMD resources page. So the dark blue represents high deprivation, and the lightest colour is the least. So you can, and these are for the LSOAs, 125 LSOAs within Portsmouth. It shows overall that the most deprived areas in Portsmouth are to the west of the area and the least to the right. So there's a east-west divide. At the top, alongside this, at the right-hand side, there's a little graph that shows the distribution of the ranks of the 125 LSOAs or neighbourhoods within Portsmouth. It's basically saying, you can see the top, there are 12%, that's 15 of the LSOAs are in the most deprived areas nationally. These are deciles, so that's in the 10% most deprived areas within England. Now, it's useful to look at these things, but in order to summarise what's going on, we need to download the data, and then we can drill in and match up to wards with high and low levels of deprivation. So if we look this map at the sort of the blob at the bottom, the dark blue blob at the bottom, that's within there's Charles Dickens ward, of which 11 of the LSOAs within that ward are in the 10% most deprived nationally, and 2 of these are in the 1% most deprived. You can see where the Portsmouth wording is across the bottom. There's a light area there, so quite close to very deprived area is as a relatively well off. This is around the generation, around the dock area and the sort of historic old Portsmouth area. So the next slide, please. So as well as looking at the overall index of deprivation, what we did was for each of the domains, we produced a little summary. So we described the domain along the top, and then there's a picture that you can, a map that you can download of the distribution of the LSOAs within this domain, and you can see that there's a lighter sort of, it's not as dark as the previous overall IMD picture. The average IMD. And then for each of the domains, we produced this summary that looked at where the most deprived areas were within that. So alongside, the detail's not important, but say of the 125 LSOAs, 12 are in the most deprived nationally. 7 of these are in Charles Dickens ward and the other wards. We also identified, again, where the least deprived wards are. These are the sort of top right-hand side. And then made a sort of other sort of summary that says, basically, for the income domain, the LSOAs generally score better than the overall IMD. So although it's important, it's not the main driver of deprivation in Portsmouth. So providing some sort of context and summary about what these domains show at a very high level, descriptive sort of point. Okay, can I have the next slide, please? Oh, sorry, no, can I go back? Sorry, I've missed something. In order to do this sort of further sort of going down the granularity, going down the sort of descriptions, we downloaded the data from the website, and as the LSOA level data are not familiar, a familiar geography really on the ground, we related them to wards by using the ONS lookup tables, which give a best fit from LSOA to wards. So an important point here, I think, for us were that some issues that I found that we can't download data, found it difficult just to download data from Portsmouth. We need to download the whole of England and Wales and select the data for Portsmouth. And this can be a bit overwhelming if you're not used to manipulating large data files. So you've got to go from 33,000 records down to 125 we needed for Portsmouth. And then further to that, matching to wards means knowing how to find the lookup tables, downloading these and matching them across, having to understand what the various codes were and how they work for the matching. So that's even more complicated. So the next slide, please. So this is my final slide. While creating a report that describes the patterns of deprivation in Portsmouth was just one part of the project, it has provided valuable insight into understanding the local population that CAP supports, and and can be set aside and complement local knowledge. That can be used for existing data. It can be used alongside as well existing data that CAP collect to identify groups that they may not be reaching, as well as providing context to better understand the results of the online survey that we carried out. And it's a resource that can be used in the future for funding. We think that this project illustrates the importance of small area data to provide evidence for those delivering essential services to the vulnerable in their local communities. There is an enormous amount of information and data available. High-level local authority maps and the interactive maps are very good for exploring, and the reports on the IMD are detailed. But so much information can be overwhelming to understand and manipulate to get useful local summaries. I did find it quite challenging, and I have quite a lot of experience of official statistics. One of the aims of this project with CAP was to explore preferences for how advice can be accessed. So it's important to consider how those who might be in need of CAP services could be affected by increasing technological service. An insight from this project is that digital exclusion is a real concern for the vulnerable, and is becoming increasingly considered as a new form of social deprivation, whose impact has been exacerbated by the pandemic. However, digital exclusion does not feature within the indicators, and in fact there is no single official data source covering this area, and the data that is available is not at small area level. So we think this is a gap, and would like to ask if this is being considered now, or when for when the IMD are updated. So I'll finish with a request for more, and I'll hand over to Jan, who's going to say a few words.
Okay, thank you, Marie. Can you all hear me? Yes?
Yep, we'll hear you fine.
Great, okay, thank you. I'm Jan Thomas. I'm the Business Development Manager for Citizens Advice Portsmouth, and I commissioned the project. And to start off, we'd just like to say that at Citizens Advice Portsmouth, we're very, very grateful to the RSS for the Statistics in Society programme and for the offer of pro bono resource, because obviously, as an independent charity, our funding is very restricted. It came just at the right time for us because we were planning a client needs survey to support a large tendering exercise. So to get the resource at exactly the right time to give us the insights that we need was a fantastic opportunity for us. As Marie explained a bit, Roma and Marie advised us on the question wording and the sampling frame for our survey, and then carried out the local demographic analysis that Marie's just described. They made comparisons with our client base and drew conclusions for us. They also analysed the IMD and provided commentary on our local issues. So I'd just like to really say that this work's provided invaluable insights into our local knowledge to help us identify those groups that we might not be reaching and to better understand our survey results. We've got a wealth of evidence now to support us going forward. So we'd very much like to thank Roma and Marie for their expertise, their ideas, their collaboration, and for going the extra mile for us, as Marie has already explained. We have published and publicised and promoted the RSS Statistics for Society programme nationally, internally across Citizens Advice. So you may well find that you're getting other inquiries from Citizens Advice organisation. So from a very, very grateful user of the service, thank you.
That's great. Thanks, Jan, for that. We've had some great talks and we're nearly at the end of our session. So we've got time for a few questions, and I've kind of made note of some of the ones that have come down, and there was a few that kind of continued to go in, and they're aimed at the initial speakers around and if they want to unmute their mics and maybe turn on their cameras, that would be great. And it was around the ingredients. So one of the questions was, who decides the ingredients for these indices and the way in which they're weighted? And another was around where the raw data and where it is that go into these. And this kind of came up a few times in the chat. And I just thought, given we've only got a couple of minutes left, might be good just to finish on that before I thank you all for your excellent talks.
Well, can I just make a point? Bowie has been very industriously typing into the chat as we go along. And I think
Yes.
that's his greater flexibility of the younger mind. But yeah, so there's lots of stuff in there, but I'll shut up now.
Did any of you have anything you wanted to say on that in response to the kind of the questions around where is the raw data that goes into it and the data that kind of makes this up? Is there any, or is it a kind of bigger question that?
No, it's not. It's all there.
Yep.
At different levels. I think, yeah, I mean, if one goes to the main website for the individual indices, all the supporting documents are there. So if people are finding it difficult to find it, then, you know, we can help, but they're certainly all published. The one thing I will say, we don't publish the raw scores in Scotland for various reasons. We'll provide them, but we usually found that people tend not to use them properly. So now I'm pointing people towards Alex Parsons' GitHub resource, which has a really nice explanation of how you do it, and he's also got the data. So another plug for Alex.
Brilliant. And the links are all in the chat. So guys, if you haven't seen any of those who've asked those questions, please read through what's in the chat. Thanks, Bowie, Elizabeth, and Nia. I saw you answering a lot of your questions. Nick also. I also will want to thank all the speakers. So that would include Marie and Roma. And just thanks for an excellent session, because it's been really interesting to kind of get the details from you guys initially on what it's all about, but also the applications that have been done through those volunteers, through Statisticians for Society. And you know, if people are interested in this and think this could apply to their charities, please contact Statisticians for Society and you could get the use of excellent statisticians like you've seen today. So I'd just like to thank all the speakers. Thank you all for being part of this. And it looks like we're going to finish this on time. So enjoy your day, and thank you for everybody who's joined us today. It's been an excellent session, and it's always the speakers who make it. So thank you guys. It's been much appreciated. Thank you very much.
Thank you.
Thank you.
Great participation.
Yes. Yes.
And if
In real time.
Yeah, we'll, you know, we're as part of that service. We do speak to people. So contact us directly by all means. Thank you very much.
Excellent. Thank you guys. Thank you.